Good evening, good afternoon, I should say. I decided to change the view. You see, gave a little tree action in the back. Welcome to the Rhythm Notes of Health with me, Kai Ayenta. I am the soul of public health. I am excited today about our guest, Dr. Mike Jones. He's going to be talking to us about something very important, the nerve of my health. Although we're doing the men series and this is for the men, the women will be able to use something from this podcast. So let's bring him in and let's get this thing started. The Rhythm Notes of Health. Let's bring in Dr. Mike Jones. Dr. Jones. Gonna get Dr. Mike Jones. Welcome to the Rhythm Notes of Health podcast.
Thank you. Thank you. It's a pleasure to be here.
Oh, I'm so excited.
Me too.
Yeah. You like that? That's my song. I have a producer friend. You got to know somebody who knows somebody. For me, I know somebody.
Right.
I have a producer friend who did this song just for my podcast. So it is an original song that he did for me. That's why you be nice to people, because you just don't know when you're gonna need it, right? But he did the podcast just for me, and the Rhythm Notes of Health, right? Because he
Okay.
knows what I do. But let's just get into this nerve of my health podcast, because I know I'm on your time and I
Oh,
appreciate
that's
it.
okay.
I always say, I don't know, because you said it's the Tuskegee people. I don't know if it's Tuskegee people, but I can't never get y'all on here. But when I get y'all on here, it's always so much fun.
That's right. That's right. That's right. It's like homecoming all over
It's like
again.
homecoming all over again. So 20 years in the bag is what your bio says. 20
Yeah.
years in the bag. Why
Yes.
don't you, Dr. I was saying Mike Jones, Dr. Mike Jones, why don't you tell us exactly who you are
Well,
and what you do
Michael
and what you
Jones
do?
is my name, and I am a board certified neurologist. So a neurologist is a specialist who primarily deals with diagnosing and treating problems of the nervous system. So the nervous system, by and large, comprises the brain, the spinal cord, the nerves, and the muscles. So any medical entity that comes under that heading would probably be within the realm of things that I see and treat.
Mm-hmm. And what is it? What is you said it comprises the what nerves again? You said the brain, the spinal
Yep,
cord.
the brain, the spinal
Mm-hmm.
cord,
Mm-hmm.
and then the nerves branch off of the spinal cord, and they attach to various organs in the body, skin, and muscles.
Okay.
So your brain is like the computer. The brain has to know
Mm-hmm.
what's going on at all times throughout the body.
Mm-hmm.
And nerves and the spinal cord are the primary manner in which your brain receives messages from the environment and from
Mm-hmm.
itself
Mm-hmm.
internally.
Mm-hmm. And so according to your bio, you're 20 years in the bag, right?
Well, actually, you know what? Now, it's been 23 years now that
23 years. And we're gonna count those three.
We will count those three.
Yeah.
That's how long I've been here practicing in Chillicothe, Ohio.
Okay.
Yep. So I got to Chillicothe in I believe it was 1998.
Where's Chillicothe? Is that right? Chillicothe?
Chillicothe is about an hour south of Columbus, Ohio. So Columbus is pretty much right in the middle of the state, and Chillicothe is about an hour due south of that.
Okay.
Yeah.
And how long have you been there?
I've been here for 23 years. I started here in July of 98.
Wow.
Yeah.
Wow.
Been here quite a while.
And it's important to say, Dr. Mike Jones, TU. Right. That part. It is important for me to say in the podcast that Dr. Jones started from a undergrad historically Black college and university, HBCU. That's important correct. For me to say, because people think that we don't produce good people, right? And successful people. And so I am one of those persons who always let you know that HBCU grad, right?
Absolutely. I think the annals are full of products of HBCUs have gone on in every field of human endeavor to accomplish great things.
Yeah. So I'm so very excited and it's important for me to use people that I have relationships with, right?
Sure.
And so I'm very, very excited. So we were doing this men series. I'm sure that you heard a show or two. So we're doing this. We first did a women's series, right?
Hmm.
And then we're talking specifically about women. So then we moved it to the men's. Like, men, it's your turn. So the reason I wanted to talk about nerve damage, and because I really want men, and we talked about earlier that this podcast will be for men and women, right?
Hmm.
Although it's a part of the men's series, it's for men and women. It's important for us because oftentimes we talk about hypertension, we talk about diabetes, right? And we say, take your blood pressure medicine, take your diabetes medication, or your sugar medications, as we call it in our neighborhoods, right?
Right.
We say take those medicines, because if you don't, your foot can be amputated, or you can go blind, or you can have a stroke, and you can have a heart attack. But those things will kill you. But sometimes those may not be the worst things that can happen, right? You can
Absolutely.
have nerve damage from these things. And so I think the importance of highlighting or educating us about the nerve damage is, maybe we'll get it if we go backwards, right? If we go
Okay.
backwards, we know the extreme cases that will happen, that you can die, right? And you would think that would make us think differently, but oftentimes it does not. And
Hmm.
you know that you can go blind, right? And I guess people think, well, I'll get a cane or I'll get a walking dog and I'm still alive, right? And then they think I may get something amputated and I can still move around. But what happens when you have these nerve damages, right? And there are some extreme things that may happen. You may have a stroke, and some extreme things may happen. You may not be able to care for yourself. We really have to talk about those things, right? The result
Absolutely.
of the untreated hypertension, the results of the untreated diabetes, these other things other than kidney failure, which I talk about a lot, right?
Right.
Happens. There are some other things that happen that are extreme and that people may have to see you, right? So
Absolutely.
first I want to talk to you about, I and there's no need for us to kind of go into hypertension and those numbers, because I talk about them all the time, right?
Okay.
And diabetes and what it is, because I talk about those things all the time. So I think that the Rhythm Notes of Health audience is clear on what hypertension and diabetes is, right?
Okay.
So what I want to get to is what happens when a doctor or a patient comes to you, and they have not been treating their diabetes or hypertension. You can pick which one. You can pick.
Okay.
Sometimes they go hand in hand. Sometimes they're individualized, right? But
Right.
what happens when the doctors say, we need to send you to Dr. Jones? What patients do you see?
Well, usually that happens when, as you mentioned, an individual may have uncontrolled diabetes.
Mm-hmm.
And over time, the accumulation of that excess sugar interferes with the way that energy is produced in the cells, and it can damage nerves. So some of the signs of that damage might be numbness or tingling in your feet. Primarily starts in the feet, and then over time, if it goes untreated, it may start to ascend up to the knees and even involve the fingertips.
Mm-hmm.
So one of the main things first is numbness and tingling
Mm-hmm.
of the feet and toes.
Mm-hmm.
Sometimes it can cause even pain in the feet and toes. And diabetic neuropathy is what that's called. Neuropathy is a
Mm-hmm.
term that means diseased nerves, and
Mm-hmm.
diabetes is a common cause of that. Um, Excessive drinking, alcohol,
Mm-hmm.
is another common cause of nerve damage. In fact,
Ooh, say that again, that part right there. What about alcohol? Let's talk about that.
alcoholism
Mm-hmm.
and diabetes are two of the most common causes of nerve damage in the United States of America.
Mm.
So that is important. That is
You know
important.
why that's important? You know why that alcohol is important? And not that the diabetes is not important, because that's what we're talking about. But the
Hmm.
alcohol is so important because we know that if you turn the TV on, if you turn reality show on, there's a liquor store, a package store, or however they want to encase the alcohol, right?
Right.
In the brick and mortar, if you will. It is one almost on every corner in urban neighborhoods, right?
Right.
And so, since
Absolutely.
that's majority of our population, what we're talking about, it's important to understand that when you stop drinking alcohol out of moderation, you're just drinking it every day, all times
Right.
a day, and
Right.
you're alcoholic, or I shouldn't use that word so loosely, because according to the therapist, that's a very vague term. But
Hmm.
if you if you're not clear on what this alcohol will do to you, if you are just drinking it, right? The extreme case, right? You think
Yes,
you hung over. That's the extreme case. I got hung over from the alcohol, right? But
alcohol,
now and you also may be dehydrated, right? But
right?
what you're saying now is that alcohol and diabetes is the two most common cause in America of nerve damage.
That's true. That's
Wow.
true. Alcohol is toxic to essentially every tissue in the body.
Mm,
Now, in moderation, as you mentioned, of course,
hmm
the likelihood of you, suffering some severe nerve damage is probably low. But
hmm
as time goes on and your intake becomes excessive or
hmm
increases, then certainly that's going to cause problems with nerves. It's going to cause problems with other organs as well, as you mentioned, your heart,
hmm
your kidneys, your liver. Everything is linked together.
hmm because this is how I am. I always tell people I'm forever a learner. And when you say things and it excites me, and I'm sure that everyone wants to know about what the things that excite me because they always say you ask the right question. But now, literally, earlier you said that when you start having numbness, right,
Yes,
in your feet and in your lower limbs, right,
yes,
that you should be concerned, right?
yes, you should be.
Let's just talk about that. And I know that may go to the left or to the right or the diabetes, but if something comes up and I know that people want to know and people are talking about, then I want to address it, especially since I have the neurologist on here. I don't know how often I'm going to have neurologists on here, but since I have them on here, let's just talk about it, right?
Right.
So if a normal person, right,
Hmm.
is having numbness, let's just say, because I was told recently by the chiropractor, right, that
Hmm.
when you get older, you may have some numbness when you lie down. Okay, you know how when people say they use the bathroom, if they sit in the bathroom too long, they get numbness, right?
Yes,
Okay,
yes.
see, I thought that was a thing that when people get older they have, but younger people say that they were sitting on the toilet a long time and then they became numb also, right?
Yes.
So hold that thought because I'm gonna
Okay.
ask you about that. But
Okay.
also, when people are going to sleep at night, is it normal for them to have numbness if they lay on one side and they maybe sleep on this side and it becomes numb, but when they
Yes.
were younger this may not have happened, right? But it's happening as they get old. Is it an age thing or is it something else? That was
As
two questions I asked you. You remember?
right, right. As we get older, we tend to develop bone changes in our spine,
Mm-hmm.
and I guess we could casually call that arthritis. So, as we get up in age, you develop arthritis, and there are nerves in the bones or between the bones in the neck. And as we get older, that arthritis can build up around those bones. And if you're sleeping and you turn your head a certain way, it can compress those nerves and it can cause numbness. Um, you
Uh-huh.
also have numbness. Carpal tunnel is something that you may have heard of. It's a pinched nerve at the wrist,
Mm-hmm.
and that frequently causes numbness at night. It generally causes numbness of your thumb, your index finger, and your middle finger.
Mm-hmm.
Sometimes, again, getting back to the alcohol part of this, if someone
Mm-hmm.
has a little bit too much to drink, they may fall asleep in such an awkward position and can compress a nerve that extends the wrist and straightens the arm out.
Mm-hmm.
And that can be a serious situation because it may or may not completely return.
Mm-hmm.
So, if you sleep in a position where the nerve is vulnerable to compression,
Mm-hmm.
and if it's compressed for too long, the nerve is not going to get oxygen and blood, and
Mm-hmm.
it can suffer injury.
Mm-hmm.
So it's not necessarily age related
Mm-hmm.
unless we're talking about arthritis in the neck or the back.
Mm-hmm.
When people lay a different way in bed, if they may lay a certain way on the side or whatever, if you
Mm-hmm.
get numbness in your legs, then and pain with that numbness in the back, then that can be a sign that there may be some arthritis in the back, compressing nerves in the back.
Mm-hmm.
There are other,
What about the whole toilet thing? If you're sitting on the toilet for too long.
now some people have most of your listeners have probably heard about the sciatic nerve.
Mm-hmm.
The sciatic nerve is the largest nerve in the body.
Mm-hmm.
And if you were sitting on the toilet, if you stand up, actually, it's the sciatic nerve is right where the butt crease joins the lower leg. So
Mm-hmm.
if you can picture
Mm-hmm.
that,
Mhm.
on each side. The sciatic nerve is right there, and that's pretty much right where you're sitting when you're on the toilet.
Mhm.
So if you're sitting on the toilet for too long, you're going to be compressing that sciatic nerve. And when
Mhm.
nerves are compressed, they don't get proper amounts of blood, and blood
Mhm.
contains oxygen and it
Mhm.
contains an energy source called glucose.
Mhm.
And every cell, every organ in the body needs to have both of those in order to function normally.
Mhm.
So that's what happens when you sit on the toilet too long. Your legs start going numb. It's compressing those sciatic nerves.
Uh-huh. Uh-huh. And that can happen at any age.
Can happen at any age.
Uh-huh.
Probably more likely to happen as we get older, because as we get older, we tend to pick up a few pounds.
Mhm.
And if you're heavier, more weight sitting on that, then that
Mhm.
is probably going to be more likely to cause trouble.
Mhm.
Or
Mhm.
the opposite side is if you've had excessive loss of weight, where you don't have the normal
Mm.
padding to protect that nerve when you're sitting,
Ah.
that can cause a similar phenomenon as well.
Uh-huh. Uh-huh. And now, do you have patients that ask you about that, ask you that question
I
about
don't
the
have,
numbing, the
I haven't,
tingling?
well, oh, absolutely. I mean, there are so many different things that can cause numbness and tingling.
Mhm.
You may or may not have heard about what we call restless leg syndrome. So
Yes,
people get
yes, yes,
these,
yes, yes. Mhm.
they experience these strange sensations in their legs at night. It can be pain, it can be numbness, it can be tingling, it can be a crawling sensation, but in general, it's usually some type of discomfort in the legs at night.
Mhm. Mhm.
Diabetes can cause that. There are
Mhm.
multiple other medical conditions that can cause that too. So it's
Mhm.
another reason that your legs and toes might go numb or get tingly at night.
Mhm. So if your legs are, if you have an uneasiness in your legs, if you
Yes.
will, then
Yes.
that's a part of the restless
Yeah.
leg syndrome.
Restless leg syndrome. Yeah. Usually
Mhm.
cause some discomfort in the legs at night.
Mhm.
And even as it progresses, it can even cause discomfort during the day when you're just sitting or inactive. So
Mhm.
many people will tell me that their legs feel better if they get up and walk around. Even during the night, they can't get
Mhm.
comfortable. They have to get up and move around, and
Mhm.
that eases the sensation
Mhm.
for a bit.
Mhm. And so, Dr. Jones, now I am so enjoying this podcast, like really and truly, because I mean, again, I like learning. So earlier you said that inside of the cell, right, there's energy, right? It says there's
Yeah.
oxygen is energy, and you said the energy is called glucose,
Hmm.
right? Can you talk a
Energy
little bit more about that? Mhm, go ahead.
glucose is an energy source. So
Uh-huh.
every cell in your body has to have oxygen
Hmm.
and sugar. Now, it's not the type of sugar that's on your kitchen table.
Right, right.
Most of these are simple sugars that are in
Uh-huh.
fruits.
That
Those are
can be
the
broken
simplest,
down
absolutely. Those are
easily.
the
Hmm.
simplest sugars that your body can use,
Hmm.
not processed sugars that are in soft drinks and
Correct.
candy.
Hmm.
Your body really has to work hard to break those down into a usable energy source.
Uh-huh.
So your body, every cell in your body has to have sugar, because sugar
Gives you energy.
gives you energy.
Uh-huh.
It enables your body to produce energy,
Hmm.
and it needs oxygen for that process as well.
Okay. Uh-huh. And so the glucose, you said, gets it ready for the to break down the sugar, because you
Well,
said that the energy needed glucose and
well, glucose, this is going back to some complicated
okay,
microbiology
we're gonna break it down. It's real
and
simple for layman
biochemistry for
people.
some people, but each cell has what we call organelles.
Uh-huh.
So an organ is like
Uh-huh.
the heart or the kidneys or the liver. Each cell has small structures that
Helps it function.
helps it function.
Uh-huh. Uh-huh.
One of these organelles is called mitochondria.
Okay, yeah.
So
The
remember, the
mitochondria.
mitochondria is where the
This is what we
actual
gonna say.
energy
This is what we gonna
source
say.
is produced.
This is what we gonna say. This is what we gonna say.
Okay.
Like really true. That took me right back to biology 101, right? But when that mitochondria didn't make sense to us, right? And they really should have had some doctors in there helping to make sense to us. I always say that, like, if they had told us this about the
That's right.
mitochondria,
That's right.
it would have been so much easier, right? But they didn't tell us
Right.
that. So now that we're talking about this, so what we'll say is like each cell has like a machine. We'll
That's
use
right. That's right.
machine, right?
Has
For the
machinery inside
mitochondria
of
is a
it.
machine that
Right.
has to function together to make it run
That's a
or
great explanation.
properly Right. That's why when the cell is sickled, and I'm not going to talk about that, I'm digressing. That's why when it's a sickled and not perfectly round, then that
Right.
machine can't run properly.
Right.
Right.
That's correct.
Okay. All right, cool. Okay.
That
Okay.
is
I'm fine.
correct.
Okay. I just want to make sure that we're clear on all things when we're talking about them. Otherwise, we're not educated, right? So the nerve of my health. So the nerves are very, very, very important, right?
Yeah.
And general practitioners or general doctors, right, may talk about things, but not in detail about the nerve. You have a specialty, hence is why you're a neurologist. I'm just explaining to the people exactly who you are. You have a specialty in this area that you deal with just nerves, right?
That's right. That's right.
The nerve of my health, right? The nerve of my health, right?
Absolutely.
So when patients come to you, right, they have these problems. Let's just say an extreme case of hypertension. Now I'm saying extreme case, because people take these words and they'll use them against you. They'll say, and on your podcast, you said extreme case, right?
Right.
But listen, but they call hypertension the silent killer, right?
Yes.
Because you don't see it coming. You think I'm fine, and your blood pressure is up, and then what happens is what's the worst that can happen? And you're still alive.
You have a heart attack or a stroke.
Heart attack or stroke. And when they have the heart attack or stroke, does that bring them to you?
The stroke absolutely brings them to me.
Mm-hmm.
So, that kind of now, we talked about the brain,
mm-hmm.
and we talked about nerves in the spinal cord. So, a stroke is a brain event.
Mm-hmm.
And all of these things that we've talked about can increase the risk of having a heart attack or a stroke, diabetes, high blood pressure, alcohol. Those are major things that can increase your risk for stroke. Other things are, if you're overweight or if you're inactive, things in your diet that have a lot of salt or sodium in them can increase your blood pressure. So the thing that happens with regard to elevated blood pressure that usually brings them to me is that they have another thing that can be numbness or tingling, but usually if it's a stroke, it's going to be on one side of the body. So when we talk about diabetes affecting nerves, it usually causes numbness and tingling on both sides of the body.
Let's start right there. Let's start right there. So
Okay.
you said with the stroke, with the hypertension is normally on one side.
Yes, that means it's a brain event. Yes.
A brain event. It's a brain event. But with the diabetes, it's normally on both sides.
It's usually on both sides.
Okay.
It starts in both feet and causes trouble in both sides of the body, usually equally. Yes.
Equally. Okay.
But if you have numbness and tingling on one side of the body, face, arm, leg, that is definitely, don't wait for that to go away. That can definitely be a warning sign of a stroke. Particularly if you have changes in strength, speech, your ability to pay attention or understand language, problems with balance or coordination, headache. Those are things that can result from hypertension if it's causing a stroke. So, we want to be on the lookout for that as well. Now, high blood pressure can indirectly affect nerves. But if you have elevated blood pressure, like if you're systolic, I'm sure you've probably educated your listeners.
Yes.
Systolic and diastolic. So if you have a systolic blood pressure that's greater,
which is the top number.
Yes. That's going to more likely cause a stroke than it is.
No, I'm sorry. I didn't hear the number. You said that's greater than.
200.
200.
Yeah. I mean, if you have a systolic blood pressure that high, that's big trouble. So you're at high risk for a heart attack or a stroke. So, that would probably be more likely to cause a stroke than it would the numbness and tingling in both legs and feet, which is, that's usually something that goes along with diabetes over an extended period of time. There are other things that can cause what we call neuropathy too. Medications can cause it. We talked about alcohol being a major cause of it. Chemotherapy, that can cause numbness or tingling or an injury to nerves. So there are many different things that can cause it. But since our focus today was, complications of diabetes and hypertension as it pertains to the nervous system, those are things I want to touch on.
So when as we talk about men's health, when Dr. Fossil. You know Dr. Yeah, of course you know Dr. Fossil.
Oh, you know I know Dr. Fossil.
Of course you know Dr. Fossil.
Oh yeah,
But
yeah.
yeah, of course. So
You're just like I am.
yeah, exactly. You can say that. This podcast is for Afro descendants. Although everybody listen to it is for Afro descendants, so you can say what it is on here, right?
All right.
So when Dr. Fossil, who is mm,
Dr.
what is
Fossil's a
Dr. Fossil?
urologist.
He's a neurologist. Thank you.
Urologist.
I mean, he's urologist. He's urologist. You're the neurologist. So
Yes.
he's a urologist. So he talked about three things that may cause a male not to be able to have an erection, right?
Yes.
And one of them was nerve. Your nerve has to be able to, you have to have the blood flow. So your nerve, right? So,
right.
And I want to pull that over here into the nerve of my health, because if you have a stroke, right?
Mm-hmm.
How does that affect the erection, if you will, in men? Because I want men to get it, because men you don't even know how many phone calls or text messages I get about some young person. And when I say young, I mean our age, we're young,
Mm-hmm.
Has had a stroke or a heart attack and now is dead, right?
Right.
Or they're now in some type of long-term rehabilitation because they've had a massive stroke, right? So because and one of the main reasons that they're not taking their blood pressure medication is that, some of it may cause them to have impotency, if you will, right? Some of it may.
Right.
So you're worried about this because they do have some out there that's not going to cause that. And I always say you have to communicate with your doctor so they can get the best medication for you. So
Definitely.
if you're not taking this medication, right, and you're not taking it for this reason, at worst, the nerves can happen with what? You go ahead, Dr. Jones.
Yes. So, I'm going to now, generally, a stroke probably will not cause erectile dysfunction.
They need to know that. They didn't even know that part. But go ahead. No,
Listen.
Go ahead.
I want to clarify that the risk factors for stroke can interfere with normal erectile function. And those risk factors are diabetes, high cholesterol, untreated high blood pressure. Those things destroy arteries throughout the body. Whether those arteries are in your reproductive organs, whether or not those arteries are in your eyes, whether or not those arteries are in the nerves, everywhere in your body where there are arteries can be affected by diabetes, high blood pressure, and alcohol, and high cholesterol. So those are the things that cause all these these troubles that have a higher propensity in our communities as well. Some of those things may be genetically related. Some of those things may be some of our cultural nuances, the things we eat and how we live our lives.
Yeah.
But these are, if we want to reverse these things, and you mentioned erectile dysfunction, that usually happens as a result of injury to nerves and arteries, which comes from those things. The diabetes, the high blood pressure, those things destroy arteries, and nerves have arteries. So if the artery isn't getting blood to the nerve isn't going to function. And regardless whether or not that nerve is something to do with your vision or whether or not that nerve is something to do with erectile function, it's not going to function properly. So,
and Dr. Jones, so because because you're probably the first doctor, and I'm sure it's because of your specialty, that has really mentioned alcohol as much as you've mentioned it. And so that's important for me, especially since it is sensationalized in most everything that comes in front of you on TV, right? Which we know is a part of the whole economics. Some of my doctor friends were saying, how everything was shut down during COVID, but the liquor stores or the package stores, the corner stores, they were still open and functioning, right?
Oh, absolutely.
And one of my doctors, who's a friend, who's an emergency room doctor, she said that they actually want it to stay open in the emergency room because she said it was two things. Some people have this disorder, where they're gonna start, I guess, having oh boy, let's see. I guess they're gonna have some type of, I'm gonna use the word because I can't think of what she said, some
Sure.
type of meltdown because they are alcoholics, right? And
Uh,
having the stores open, oh, withdrawals. They're gonna say have,
right,
so such a
right,
such a
right.
word.
Okay.
They'll start having these withdrawals, and also people were literally having these mental breakdowns and having extreme anxiety, if you will, from COVID. And so they were not even telling people, right? Now, mind you, this is kind of in an urban neighborhood, sidebar. They
Hmm.
weren't even telling people that you should not be drinking as much as you're drinking because you're stressed. Because I think their thought process was one thing is outweighing the other, right? But the importance of it to me is because, you know, because now they say with working out and these keto things and so they say with alcohol, the young girls, if I'm out and the young girls, they not mixing drinks, they just straight drinking, taking shots, right? That's the
Hmm.
new thing, if you will. They just, because they said, oh, they don't want the sugar of all the extras, and they're just drinking these things straight, right? But my problem with that is that they're actually drinking more, and they're drinking more excessive, and now they're craving the more because of the feeling that they're getting from this, right? and
Right.
and it's everywhere, right? We know that it's a part of the economics of America, we know that, but we
Hmm.
still have to understand the extreme of what alcohol does to you. And so I'm so glad that you have said that alcohol is one of the second most common problem causes of nerve damage in America, right?
That's right.
That's
That's right.
so important to know because I don't think people know this, right? Like I didn't know it.
Right.
I didn't know it, and I think I know a little bit, right? So I'm so glad that you're saying this. This is like so, people say to me, don't public help me. And they'll tell me that in a minute, don't public help me in one breath. Another breath, they'll be asking me questions. But
Right.
but that alcohol portion is so important because we do have in urban neighborhoods, we have a liquor store on every corner, if you will.
We
That
do.
part is so important when you're talking about it can cause nerve damage. So when it causes nerve damage, is it causing this nerve damage from strokes? Or how is the alcohol causing the nerve damage?
It's causing nerve damage because it's toxic to the
Mm-hmm.
nerve.
Mm-hmm.
Because again, it interferes with the nerve's ability to to make energy. It
Mm-hmm.
also, increases the likelihood of substances like, if I'm trying to explain this in such a way to understand that
Yeah, go ahead. Go
it's
ahead.
oh well, basically it's like poison.
Mm-hmm.
Poison is toxic. I mean, if there's certain types of alcohol that really aren't meant for consumption, like rubbing
Mm-hmm.
alcohol. So,
Yeah. Uh-huh.
that it's going to be toxic. Now, uh, alcohol that we drink,
Mm-hmm.
isn't in the same vein as that, but
Mm-hmm.
it does cause toxicity to
Mm-hmm.
cells. It causes toxicity to muscle cells.
Mm-hmm.
People can go into heart failure because, it alcohol is toxic to the cells in the heart. It's
Mm-hmm.
toxic to the cells in the nerves. It's toxic to
Mm-hmm.
the cells, throughout your body.
Mm-hmm.
So it causes damage because it interferes ultimately with the cell's ability to be viable
Hmm.
and to be healthy.
And the dehydration, right? That's important,
Oh,
right?
dehydration
Mm-hmm.
also, because your body needs water for
Mm-hmm.
everything.
Mm-hmm.
Water is necessary in order for the body to maintain, a normal homeostasis, normal
Mm-hmm.
blood pressure.
Mm-hmm.
There has to be, adequate amounts of fluid present in your body in order for any of
Mm-hmm.
that to happen.
Mm-hmm. And when you say the normal homeostasis, you mean what? Because I mean, I know, but people don't know. What, like, what do
Well,
you mean?
homeostasis means the order in which things depend on one another in order to function normally.
Correct. Okay. Mm-hmm. Mm-hmm. Absolutely. So now so we're talking about diabetes, right? And the nerve of
Yeah.
my health, diabetes, the hypertension, and so because it's some people who have all three of those things, right? They
Oh,
have all three of those things, right?
not
And
unusual.
so not
Yes.
unusual. And so this is a recipe for disaster because you
Yes, it
really
is.
using the alcohol to cope with. I got these other problems,
Right,
which
right,
avoidance does not resolve. Now you got problems on top of problems on top of
right,
problems, right?
right,
And
right.
and, and I want people to be clear. We're not saying don't drink because you said early in your caveat that hey, I'm not saying you're drinking in moderation is doing, hasn't been an extreme case. But if you're an alcoholic and you're drinking for coping and you're drinking all the time, and you have hypertension and you're a diabetic and
Right.
you have high cholesterol, because you say high cholesterol too, then these things are a recipe for disaster, right?
Yep. And that in combination with, if there's, that's the single most important thing that I think that we can do
Mm-hmm.
to better our health is to at least see your primary care provider at least once a
Important.
year.
Yeah.
At least once a year, because your primary care provider is going to identify these things, perhaps even before they start to manifest clinically, meaning
Mm-hmm.
before they
Mm-hmm.
start causing you problems.
Mm-hmm.
Your primary care provider is going to check blood work, is going to check your sugar, is going to check
Mm-hmm.
your electrolyte function, your kidney functions, your liver functions, your blood sugar, and they may identify some of these problems, your cholesterol, before you even know about them.
Mm.
And the sooner we're able to get a handle on these things or identify potential problems and get them treated, ultimately it's going to equate to a better quality of life.
Mm.
You're going to be less likely to have a stroke, less likely to have a heart attack,
Mm-hmm.
less likely to have uncontrolled diabetes where you're losing fingers and toes.
Mm-hmm.
Though that's the single most important thing, is to see your primary care provider at least once a year.
For your screenings.
Yes.
And when
At
I tell
least.
you, I talk about screenings all the time because
Yes.
I'm a really big person of, I don't like the emergency room usage, right? Because we use it for these reasons instead of an emergency, because it was put there for an emergency, but
Right.
we
Right.
use them for all
Yeah.
things, right? Because
Yes.
we're not seeing our doctor. And like you said, the
Right.
doctor can check all these things. So you heard it from Dr. Jones, the neurologist, who's the specialty, right? You're the specialty, you're the specialist to the specialist, aren't you?
I am.
Yeah,
Yes.
exactly. So the specialist to the specialist is saying the first thing that you should do is see your primary care physician so that they can check your blood levels, check you out, look at you. I tell people that I can look at people and say, is she a diabetic, right? Or he a diabetic, right? Or I can look at people and say, oh, if they have a line across their nose, like, oh, they have allergies because they rub their nose all the time. But people hate that about me. Like the whole weekend, I had to be telling myself, I have on a t-shirt, nobody sees it. It says, I don't care, right? So whenever I would go into my public health mind, because I love my people and it's easy for me to do, right? And so we were eating with some people, or some other friends of ours, and they were like at the other end of the table, and they instantly, when their food came, and it was like wings and fries, they said, pass me the salt, but I didn't want to pass the salt, right?
Right.
They didn't even taste the food. It's like, pass me the salt. So my friend said, I thought you had your t-shirt on. And I was like, oh, okay, yeah, pass the salt down. And then I'm looking at her and I said, she's a diabetic. I thought you had your t-shirt on, because I can look at people, you know how people have those dark circles around their eyes and whatever. I'm like, they're a diabetic. She's a diabetic and she's down here sprinkling this freaking salt. And she probably has hypertension. They said, so you're just not gonna have your t-shirt on. I was like, okay, let me put my I don't care t-shirt. And that's just so I can chill, right?
I think we're all guilty of that. As a physician or any healthcare provider, you can see when somebody's ankles are swollen, and you have an idea about things that probably would cause that. Or me as a neurologist, I can see somebody walk and suspect that they might have Parkinson's disease or other things like that. We never you never get completely away from what you do at work, because it's just part of who you are.
Unless you put your invisible t-shirt on, then you have friends that remind you that you got it on. I thought you had what happened to you? So I told him I was gonna keep it on for a whole month. I'm gonna keep my t-shirt on I had to take it off today, but I'm gonna keep my t-shirt on for a whole month. And my daughter said something to me yesterday, and I said, I have my t-shirt on. She's like, what t-shirt? I was like, man, I don't care t-shirt. Like, that is like really big for me, because I'm such a caring, invested person into human mankind, if you will. So just even me putting that t-shirt just says chill a minute. That's what it says to me. Just chill. Like, I'm out of town, chilling. And I'm looking like, why she need this salt? She just, this wings and fries. You don't eat salt, right? So, but back to you. So I am so honored to just even have the specialist to the specialist on the show, right? I try to get the best for the people that listen in. I try to get the best. And this is like the best of the best. And so, but Dr. Jones, what is the average age, you would say, of people that you see
You
that
know,
are mostly having stroke? Do you mostly see stroke patients?
I see a wide variety of
Wide
people
variety.
for different things. I see
Mm-hmm.
headaches, I
Mm-hmm.
see strokes, I see people with epilepsy or seizures,
Mm-hmm.
I see people with Parkinson's disease, I see people with multiple sclerosis,
Mm-hmm.
I see people with various types of dementia.
Mm-hmm.
And I think I said stroke. So,
Mm-hmm.
though that is a large part of what I see.
Mm-hmm.
And of course, the people with Parkinson's and dementia are going to be, older. Those are probably people who are going to be 65 and over.
Mm-hmm.
But I see people with migraine headaches and other things. I see people with epilepsy and seizures, and many of those people are younger. Now, epilepsy is something that's generally not curable. I mean,
Mm-hmm.
so if they're truly epileptic, they may be required to be on epileptic medication for the
Mm-hmm.
duration of their life.
Mm-hmm.
So, I just see such a wide, but most of the people I see as an adult neurologist are 18 or over.
Mm-hmm.
But, the specific age is generally going to be a reflection of the problem that I'm seeing them for.
Mm-hmm.
Yeah.
Mm-hmm. What
Yep.
percentage of your patients would you say, just out of thought process and not
Uh-huh.
numbers, right? That you see have had strokes?
Well, if it's in the hospital,
Mm-hmm.
probably upwards of 80%.
Wow.
In the
Wow.
hospital,
In the hospital.
when I get consulted to see hospital patients, most of them are going to be either stroke patients or patients who are confused for whatever reason. Then the admitting doctor wants me to help to determine why they are confused in the hospital.
Mm.
So some people get in the hospital, and if their blood chemistry is not correct, or there's so many different things that can cause confusion in the hospital,
Mm-hmm.
infections,
Mm-hmm.
um, just the whole
Sedation.
sedation.
Mm-hmm.
Right.
Mm-hmm.
There are lots of things that can cause that.
Mm-hmm.
So sometimes they want to ask me to evaluate the patient just to kind of get my input on
Mm-hmm.
what that is. But yes, strokes are probably the main thing I see in the hospital when I'm
Mm-hmm.
asked to see a hospital patient.
Mm-hmm.
And then after we see them in the hospital, the neurologist generally identifies what likely caused a stroke.
Mm-hmm.
Was it a blocked artery in their neck?
Mm-hmm.
Was it a clot that came from their heart?
Mm-hmm.
Was it the long-term effects of those risk factors we talked about, high blood pressure, and causing cholesterol to clog up in arteries and narrow it and block it off? So
Mm-hmm.
the neurologist is generally responsible for determining what is the likely cause of the stroke so we can identify it and prevent it from happening again.
Mm-hmm. And so, whenever I do that, listen, whenever I'm concentrating like this, like, oh, this is like so good, this is so good. Like, no, this is so good. Like, but the people say, I always say this is so good. And so I know everybody is not a forever student, a forever learner like me, but so, just to even understand now when I see a neurologist in the hospital, I know what he's going to do, or he or she is going to do. And so just to even understand that, um, when a patient sees you, right,
Mm-hmm.
what your job is very important, because I think that, see, like, you're here on the show and I see you as the type, because I can tell what type of doctors is on my show when they come. So you're empathetic, and not all, and I say that, but not all doctors are empathetic, right? Some are very stoic, and it's like, this is what I do, and
That's
this is what
true.
it is, and it's very
Right.
scientific, and now I try not to have those people on my show because they're not relatable to people learning, right?
Right.
But
Right.
it's important that you are empathetic, right, in your approach, because these people, that they're in this state, they're in extreme state, right? And so
Right.
they're afraid, right? Now, they weren't afraid before they got here, but now that they're here, they're afraid, right? And so when you're giving them their prognosis, right? So you said it's 70-80% of the patients that you see, right?
Yes.
So when you're giving them their prognosis, right, and that is telling them what the long-term effect is, right, or what are their chances of how they live, tell us what the prognosis is.
So, what I generally do,
Mhm.
and now, stroke is a broad category, and
Mhm.
it can cause minimal problems or it can
Mhm.
cause severe and life-threatening problems.
Okay.
Now, so if it's typically what I might see might be, an individual who's had a stroke, they're in the hospital, they've probably not fully recovered from the stroke yet.
Mm-hmm.
And if they are able to talk to me,
Mm-hmm.
I try to explain to them what I think happened and why it happened. That
Mm-hmm.
goes back to the empathy because, it takes time to care enough to try to educate people.
Mm-hmm. Mm-hmm.
So, and most patients can tell if you're vested in their welfare. They can tell right away whether or not you really care about them.
Mm-hmm.
I try to explain to them, what happened and why it happened. And based on the extent of their limitations,
Mm-hmm.
I can usually tell what or how much recovery they're likely to get.
Mm-hmm.
I try to be as encouraging as I can without minimizing or being untruthful.
Mm-hmm. Exactly. Uh-huh.
Right. So, if I see a patient and they're completely flaccid and cannot move at all,
Mm-hmm.
that patient is probably going to have some long-term deficits
Mm-hmm.
with paralysis on that side of the body.
Mm-hmm.
If they can move a little bit or if they've improved even within the 24 hours perhaps that they've been in the hospital,
Mm-hmm.
those patients I'm more encouraged about.
Mm-hmm.
And, I tell them that, it's early on yet, you can continue to improve
Mm-hmm.
over the next 6 months to a year.
Mm-hmm.
We have plenty of time where you can improve,
Mhm.
and generally the sooner we get them into rehab, first again, identifying what caused it,
Mm-hmm.
if it's clogged arteries, either surgically unclog them or if they're going to need to be on a blood thinner,
Mm-hmm.
then we implement that, make sure
Mm-hmm.
we get their blood pressure addressed, get that under better control, the cholesterol. And then many of them may need physical therapy after
Putting
they
out
get
the
out of
fire. You
hospital.
putting out the fire.
Absolutely,
Okay, go
that's
ahead.
right. Because we want to attack it from all angles.
Mm-hmm.
Because the sooner you get them up and moving, inactivity is another thing that's a risk for hypertension, for high blood pressure, stroke. So, being active is protective.
Mm-hmm.
So the sooner we get them up, moving around, being active, involved in some type of therapy program, their outcome will likely be improved.
And that's one of the other reasons that you put patients into therapy, right?
Yes.
Into physical therapy, right?
Oh, absolutely, definitely,
Mm-hmm.
definitely,
Mm-hmm.
because
Mm-hmm.
inactivity is something that ultimately can decrease life expectancy. If you
Could you say that one more time? Yeah.
inactivity,
Mm-hmm.
inactivity is something that can decrease life expectancy.
Mm-hmm.
If you are not active, or if you are what's the word I'm looking for? Senescent.
Just sitting around, sitting down, not doing
Right,
nothing.
right,
And going
right.
to the grocery store is not
Sedentary,
active.
if you lead in a sedentary lifestyle.
Okay, sedentary lifestyle. I knew this was what you was looking for. I just want to tell you, just sit down. Yeah.
If you lead a sedentary lifestyle, then
Mm-hmm.
that allows other things to happen. That allows that makes you more liable to get infections and get lung trouble and heart problems and other things like that. So I'm not saying you have to run out and run a mile a day, but if you're not doing anything but walking around the block or walking from your front door to the mailbox or whatever,
That's what. That's right. It's moving.
You have to move and keep yourself active at any age. At any age.
Mm-hmm. Now, Dr. Jones, I know you have to go, and I know we can't keep you long, but before you go, can you tell us, because in the Afro-descendant neighborhood, in the urban neighborhoods, when we talk about stroke, right, we say they had a mild stroke or they had a massive stroke, or, can you just tell us the difference in those different strokes that we talk about, just so we'll know, because we'll say they had a massive stroke, right? Or we'll say they had a mild stroke, or they, could you tell us the difference? Other than the obvious, right? Can you tell us medically the difference?
Well, medically, there are generally two types of strokes. There's what we call a hemorrhagic stroke, where there's actually rupture of a blood vessel for whatever reason, and there's bleeding inside the brain.
So that's the the bleeding of the brain.
Hemorrhagic stroke. Or there's what we call an ischemic stroke. And that word ischemia means lack of blood flow to an area of the body, resulting in tissue injury or death. So if we have an artery in the brain that's filled up with cholesterol and it narrows and ultimately blocks off, blood cannot get past that blockage, and it can't get to the brain that needs it for energy and sugar in life. So that can cause a stroke as well. So two types of strokes. One where there's an artery that's blocked or narrowed to the point where adequate amounts of blood cannot get to that area of the brain,
Mhm.
or if you have a ruptured blood vessel,
Mhm.
like high blood pressure is the pressure was so high the vessel just burst
Mm.
and ruptured. Now, when we talk about massive stroke or mild
Mm.
stroke, that
Mhm.
entails the amount of injury to the brain, how much tissue injury has occurred for how long, and whether it's likely to recover it.
Mhm.
So, this goes to the part where, we say time is brain.
Mm.
So if you're sitting
Mhm.
at home on the couch watching TV and you get numbness and tingling of your face and your
Mhm.
speech isn't right and you start having double vision and you can't talk and your balance is off, you don't
Mhm.
want to sit there and wait for that to go away. Because the
Mhm.
sooner you get to an emergency facility, we can identify what the cause is, and you might even be a candidate for medication that can open up that
The
clogged
blood flow.
artery
And that's why we say fast, right? That's why we use
fast.
the word
That's right.
fast, right?
That's
You
right.
actually need to respond fast. It's an acronym, but it means
Absolutely.
respond fast, right?
That's right. That's
Yeah.
right. That's right.
Okay.
And so the amount of a massive stroke means there was a tremendous amount of injury to the brain, to
Mhm.
the brain tissue. A
Mhm.
mild stroke is, another thing, another word we used to use for that is TIA,
Oh, TIA, right?
or
Uh-huh.
stroke. And that
Uh-huh.
means that the blood flow to the area was temporarily disrupted, but probably not so severely enough that the brain won't recover.
Mhm. Now, black people, Afro descendants, are what I call them. They know TIAs. They're like, oh, they had some TIAs, and they say it
Yeah.
like it's nothing. Like, yeah,
Right.
had
Right.
several TIAs. They say it like it's a thing, right? But I'm glad that you're helping us to understand exactly what it is that we're having. And I know it took a lot for me to get you on here, but really and truly, I really have to have you back because you talked about you see patients with headaches, right?
Hmm.
And so those are those migraines, right? Are
Right.
those migraines that you'll send them? And so
Some
that
of
is
them are
very
migraines.
common.
The different types of headaches.
Hmm.
So, that's a whole different category.
Yeah,
Some people
absolutely.
have tension headaches. Some people have what we call vascular headaches.
Uh-huh.
Migraine is included in that.
Yeah.
And then there are other headaches that are caused by medical problems like brain tumors and
Uh-huh.
meningitis and strokes and bleeding in
Mm-hmm.
the brain and, aneurysms and
Mm-hmm.
other things. So that's a
Mm-hmm.
whole nother, topic
Mm-hmm.
about headaches. And,
Mm-hmm.
and there are ways that we can tell whether a headache is likely to be problematic or whether it's what we call a primary headache disorder, like a migraine or tension type headache.
Mm-hmm. Mm-hmm.
Yeah.
I can't wait for my daughter to hear this podcast because she's going to hear all the excitement in it. Because remember, I told you how she wanted to be a pediatric neurosurgeon, and then she
Yes.
spoke to someone and was like, "You're going to have so much school. It's going to be all this." But when she hears this podcast and hears you in the patients that you see and how you see them and why you see them and the impact that you're making to help us live better lives, she's gonna, hopefully it'll help her to entertain it again, right? Because you
Right.
have to understand it, because just even understanding all of the things that you do. And let me just stop and say thank you for what you do, because you didn't have to have a specialty to a specialty, because it wasn't easy. Sidebar, I know some real smart people, real smart people. Okay, but okay, I just have to throw that shameless plug in. But really and truly, Dr. Jones, what you do, you really have to know so many things, right? To even just know how they work. As we talked about the mitochondria and the machines. So just to
Right.
even understand how it all works, you have to know everything really and truly, and that specialty to really know how to put it all together, right?
There's a lot to learn, but I think that most people can learn anything based on how that information is presented to them.
Yeah, that
You
part.
know,
That
if
part.
you can present it in such a way that, and I'm a visual learner. If I can see
Uh-huh.
it, then I can understand it.
Uh-huh. Yeah.
And I would tell your daughter not to be discouraged by that. You have to
Yeah.
be driven by, what motivates you.
Yeah. Mhm.
So, she should, I don't know how old she is, but
She's 17.
oh, she'll be 26, 27 years old, and then she'll be done with Harvard training if she goes straight through.
Yeah.
But
Yeah.
it seems like a long time when people say, "Oh, you gotta go through 4 years of college, and 4 years
Yeah.
of medical school, and then all this
Yeah.
other thing." But you know,
But look
it
at the
takes,
reward. Like I can literally feel your energy, reward system of giving and
right,
healing, if you will. And I can literally feel that, and we're miles and miles and miles away from each other, but I can literally feel that energy of healing that comes from you, just even the way that you educate to even help us to understand, right?
Right.
That's very important in people getting better. And so you don't know how many people that you literally it will touch from this podcast and will educate. And just that education is going to help them make better decisions. It's going to help them drink differently, right? It's going to
Right.
help them go to their primary care doctor and get their
That is number one. Get there.
screenings that they should
Yes.
get, right?
Yes.
Just to get a baseline, just so you can have a
Right.
baseline of where you are, right?
Definitely.
You're not going to believe how many people, like literally people email me, like it's literally people all over the world. Like I had no clue. Like I know people need the information because I need the information, right? I know people are intimidated by doctors and by their title, and so they don't ask any questions, and so they don't partner with their doctors to be better. And so I am that voice, right, to help them, and that bridge and liaison, if you will, to help layman people who have no sense of science and medicine and those things, to help them understand, because the more you understand and empower yourself, the better decisions that you can make.
Absolutely.
So Dr. Jones, listen, this is real. I promise you really don't even get my excitement. So, cause I told you I came in this run and I've been doing none of that.
I do.
And I was like tired, but now I have this sense of energy, like, yeah, like just because that's what learning does for me. And really and truly, when I'm able to give information where I know people are going to love and they're going to be able to use it and make better decisions, bless you, Dr. Jones, for that. And just even taking the time to come on here. And if I always say, if it's one person, my husband always say, it's not going to be that many people who listen. But I always say, I have one rule. If I'm able to touch one person and change one person, then I really have done my job, really and truly, because they're going to tell somebody else, and they're going to tell somebody else, right?
Right.
And that's just the way I see things. So just to even have you in this field and you look like us, I for the people, because some people go to YouTube and see the podcast, right? But most people hear the podcast. But Dr. Jones is a Afro-descendant, Black man, African-American. I'm saying all the things for the people politically correct, that looks like us. So to have a person that look like you, that comes into your room, you do have some people to be like, oh, he Black. Because my doctor friends tell me that, they're looking at him like, it's a female. Like I have them say that I want a white doctor. They'll say that, right? And that's just ignorance. But for me, if a Black person comes into the room or comes somewhere, I'd be like, oh, okay, it's a Black person. So,
right.
And I think that when people have people that look like them, they can relate better to healing and getting better, because they know that I'm here to help you be better, because you did not have to do this, Dr. Jones. So just thank you and if people want to reach you, now I know that most doctors are not on social media, and you're probably one of those doctors not on social media doing your doctor stuff. But if people wanted to, if they were in your area, right? Or maybe they want to ask you a question. Can people ask you questions? Can people reach out to ask you questions?
Well,
that well is known.
Yeah, I can see me now getting 200 questions a night.
Okay, I tell you what, I'm gonna have so when you're off the show, the one thing that I do is I put your information on my website, right?
Okay.
And if they're in your area and they need a neurologist, definitely.
Okay.
So if they're in the area, let's say that. If they're in the area, if you have a question, send it to me and I'll try to get it answered.
Okay.
But if they're in the area and they need a neurologist, right? How can they find?
I am at the Adena Regional Medical Center in Chillicothe, Ohio. And you'd be able to find me with that.
Or you can Google him. Or you can go. I said it. Or you can Google him, right? And you'll find him and just put Ohio and it'll come up, because that's what my daughter was doing when she was looking for a picture. Like, oh, okay, I got it. Just
now I'm gonna tell you. Now generally, if someone thinks that they need to see me or a neurologist, most of us prefer to have a referral from the primary, just to make sure that I'm the right person that you need to see.
Absolutely.
So, we don't want to
say just come to the neurologist. You really should have a referral, right?
Right, right. And that way, your primary knows you're coming, and they
Mhm,
know that it's referral is appropriate and
mhm,
something that comes
mhm.
under my jurisdiction, so to
Yeah,
speak.
because you don't want people who saying my head was hurting 3 times last week. Oh, let me
Right.
call Dr. Mike. Let me call Dr. Jones, right? I
They gonna
had a
do that.
headache for about a
They gonna
month.
do
I
that
called
anyway.
Dr. Jones, right? Let me call him and see. Right. So, but patients can though say, hey, listen, I heard this doctor on the podcast, on the
Hmm.
Rhythm Notes of Health podcast, and I would like to be referred to him. They can partner with their doctors if the doctor says
Yes.
they need a referral. They
Right.
can't partner to say, hey, I want to try this doctor out, right?
Yeah.
But go
Yes.
through the referral because again, you just don't just wake up and be like, I'm going to call Dr. Jones. And don't be saying Kai Iansa sent you from the Rhythm Notes of Health, because I'm not the doctor. I'm not sending you there, right? So I'm not the medical doctor. I'm not sending you there. So go to your doctor, get your blood work done. So in closing, Dr. Jones, this has really been good for me. I don't know if you hear and feel my excitement, but
I
I'm
can,
so
I can, I
excited.
can.
Like,
But it's been a blessing for me to be here. And
yeah, I'm
like you
so
said, if I've
excited.
been able to help somebody understand something a little bit better, and
Yeah.
the take home message is see your primary care provider at least once a year.
Mm,
That if you don't get anything else out of this, and then the other take home message is if you have something new that's going on, don't sit around waiting for it to go away,
mm.
because it could be something catastrophic evolving that could maybe even be preventable.
That's what I say. Avoidance does not resolve. So you got to get some help. And
Definitely.
so thank you for taking the time out of your day
Well, thank
to
you.
join us here at the Rhythm Notes of Health. Skiggy Love.
Yes,
Hopefully I
indeed.
get to see you soon, like in some weeks to go. But
Yeah,
I am, and thank your wife, because I know she connected all
I
this.
will. I can't wait to call my car right when I hang up.
Yeah, I can't wait to it's I mean, and I know that because that's my excitement. I may like go all over the place, but everything went back to the nerve
Yes.
of my health. And we really learned some things that we can take and make changes today.
Oh,
Like,
good.
yeah,
Absolutely. That's what I want.
so
That's what I
thank
want.
you, Dr. Jones, for your time. And I'll let you know when the podcast is out there. And
Okay.
now I have two Kappas that's okay, then check, right? I'm like,
You.
so Skiggy Love, and I do send it out to because the Kappas my brothers. I don't know if people know that, but if you know me, you know that they are my brothers. They taught me how to date. They taught me how to not date. They taught me how to
Right.
date.
That's right. That's
Like they
right.
like really and truly, they're the ones who taught me that. Like, no, yeah, like they taught me that. So I'm proud of that sometimes.
That's right. That's
So
right.
thank you, Dr. Jones. So thank you so very much for joining us. And really and truly, I'm gonna have to pull you back in at some time in the future to talk about this. Is really, really, see, Dr. Jones, this was painless,
I knew it was going to happen. I knew
wasn't
it.
it? Yeah. Okay, thank you so much. Have yourself a good day.
Thank you, and you be blessed. And it's a
Okay,
pleasure talking to you and
I
being on your
will.
show.
I will.
Thank
Okay,
you very much.
bye-bye. Okay,
Bye-bye.
bye-bye.
All righty.
Oh my gosh. So, let me see. This always happens to me with my music when it times out. Let's see, can I get it back in? Let's see, can I get my let's see. Let's see. Oh, there it is. There it is. There it is. There it is. Okay, so this podcast has been so good for me today. But that's not what I'm supposed to be talking about. I'm supposed to be giving you the our soul notes. And let me just tell you who we're listening to and who this person is. So as you see over my shoulder, this is young lady. Her name is Now. It's Nao. Her name is Now. Is Nao, and she is from London. And my daughter all actually introduced me to this young lady. She's an English singer, and she has various sounds. And she went to the School of Music and Drama, and she studies vocal jazz. And earlier I said, "Oh, what is this song?" But the more I listen to it, the more I'm liking this song. So again, her name is Now, and it's Nao. She's from London. And again, since we're talking about Afro descendants, she is an Afro descendant, and she is an independent artist. So her social media is THIS underscore N as a Nancy AO. And it's this underscore now. Let her know that the Rhythm Notes of Health sent you over to her. Download her, stream her, check her out. I like to highlight independent artists because they don't get the airplay that they should. And oftentimes, some of them are really, really good. And so I like to use my platform because I'm No Music, No Life. And it's the reason that I am the Rhythm Notes of Health is that I like music. So check her out and let her know that Kai sent you from the Rhythm Notes of Health. Wow. Dr. Jones was so good. Like, listen, Dr. Jones was so good. Neurologist Skiggy Kappa. The nerve of my health. This was so good. I learned so many things. He told us about, see, I normally tell y'all a lot in this little closing. I'm not going to do that today because you got to go listen to the podcast. But he told us the two types of stroke, because in the Black neighborhood we say it was a minor, it was a TIA, or it was a major stroke. So he told us there are two types of stroke. He also told us that when it is hypertension, it normally it's on one side of the brain versus when one side nerve damage versus when it is diabetes, it's probably both sides of your body, right? You're gonna have to listen in to hear those details. And I don't have to say that he talked about the two most common type of nerve damages in America was diabetes and alcohol. So if you are drinking and not drinking in moderation, make sure that you are aware of what is going on in your body. And in closing, he said, hey, see your PCP or your primary care physician at least once a year. He said, if you don't get anything else from this show, see your doctor because you need a baseline of where you are. And he said, if something new is going on, don't ignore it. Avoidance doesn't resolve. Get to the doctor. Remember, and this show is really important in this, what I'm about to say. We repeat what we don't repair. We repeat what we don't repair, right? And then it gets really bad. Your race and where you live should not determine whether you live. When life moves fast and your mind does too, remember to breathe. It will get you through. Remember to breathe 5 times a day. Persistence, patience, and perseverance. My name is Kai Ienta. I am the soul of public health. Until next time, this has been wonderful. Bye.